After a life-changing diagnosis, chronic illness, or serious health event, it's estimated up to 1/3 of people experience symptoms of depression. During Mental Health Month, we're talking about when it may be time to seek help and strategies to help cope with an illness. This week, I'm joined by Dr. Katie Harry, a licensed psychologist with St. Luke's. Thank you so much for joining us.
Of course. Thank you for having me.
So, Dr. Harry, first of all, what are some common illnesses that may cause anxiety and depression?
So any chronic illness, such as cancer, heart disease, diabetes, or autoimmune disorders, and how it impacts your mental health is unique to each individual, but is very natural to have an adjustment process with some initial shock or fear of the unknown as you work to figure out how is this going to impact your life and how can you continue living with it.
Absolutely. So when is it a good time to seek help?
So normal emotions like sadness and worry are very normal. But a good gauge is if these emotions are persisting longer, if it's impacting your sleep, if it's impacting your ability to connect with others, thoughts of death. This is a good time, good indicator that you may need to reach out for support for things like personal support, support groups, or professional counseling.
Okay. So what are some strategies that you work with patients on to help them cope?
So mindfulness, grounding yourself in the present moment. Things like deep breathing, guided meditation, or mindful movement. Acceptance, so recognizing this illness is here to stay. You want to learn to live in spite of its presence. Also making healthy lifestyle changes and trying to target ones that directly impact your illness that you're dealing with. Also becoming an advocate, becoming knowledgeable about your illness and ways to treat it. And then also balancing, making time for self-care, and then balancing that with connection or spending time with your loved ones.
Okay, so expanding on one of those a little bit, how can playing an active role in your treatment really help with this?
So a big piece of this is loss of control. So becoming knowledgeable about your illness is incredibly important. So you can feel more confident going into medical appointments, asking great questions, and feeling like you are part of the medical team.
Okay. Now, what's the best way to get help? Where should you start?
So having your own support community is really important, and quality over quantity. So strong support that can help with logistics or provide emotional support. But if you're noticing that it's impacting your quality of life, that's a good time to reach out to your healthcare team to ask for resources. Or at St. Luke's, we have specialists like me in oncology, bariatrics, the pain clinic, who specialize in the illness. We also have St. Luke's behavioral health specialists who have health knowledge.
Okay, that's great to know that there's different behavioral health specialists that specialize in specific areas. Now, lastly, how can someone help others who is coping with a serious or chronic illness? What can I do for my loved ones with a diagnosis?
So ask, how can I help? So you don't have to guess. Maybe offer some things that you're willing to do and ways that you can support them.
Okay, great. Well, thank you so much for joining us.
Of course.
To learn more about St. Luke's Behavioral Health, talk to your provider or visit stlukeskc.org/behavioral. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.